Good morning, friends. Um, I was thinking of the word heritage, and I'll just read what the dictionary says. It says something that is handed down from the past as a matter of beauty, honor, pride, and courage. And I think as we just think about our heritage and the departments as they evolved, I think it's such a beautiful thing, a beautiful exercise to do it together. And I think these things that were described by the dictionary very much fits into every department that I can see in CMC. And especially today, as we are thinking about the Department of Dental and Oral Surgery, um, I'm just reminded of this word east in the Bible. East is something which is quiet, but it just works through many things. And for me, it's a wonderful privilege to introduce the speakers and the moderator for this morning. The moderator will be Dr. Santosh Koshi, and we have two eminent speakers, and we have Dr. Samraj. In a way, special to me because he's the father of my batchmate, and also Dr. Rabin Chacko. Again, worked for many years together in developing various things, including blended learning courses in dentistry. So it is my privilege to introduce them, and I will hand over the session to Dr. Santosh Koshi to moderate and invite all of you to be part of this wonderful lecture series. Thank you.
Thank you, Dr. Jaikin. A warm welcome to all of you. Today, we would like to present you the history of Department of Dentistry and the story of decades of dedication and innovation that has brought us to where we are today, that is 75 years from when the department has begun. Dr. T. Samraj, our former head, will take us through from the beginnings of dentistry in this institution till year 2000. Professor Rabin Chacko will speak about our progress from then till date. I invite Dr. Samraj to begin.
Very good morning to all the staff and students of CMC and Dr. Banerjee, who has come on my personal invitation. I was told that this is a part of the centenary of the town campus. The heritage lectures are being arranged. Same time, I also heard that this year also happens to be the 125th anniversary. So since I knew late, I had put the slide of 125 only once. So you can take this as the centennial heritage lecture or the centenary heritage lecture of the campus, town campus, or the Diamond Jubilee lecture of the dental department, which is completing 75 years now. Or I have added my own personal one. I've completed 60 years in dentistry last year. I joined CMC in 64. Let's start before the beginning. This is a Dutch proverb which says consider before beginning. Till 1943, dental treatment was being carried out as per the patient's choice, wherever he wanted to go. In 1944, Dr. Jesse David was appointed as a dental surgeon who started the department and left for the army. In 46, like the principle of CMC, like the medical camps, we had a dental camp, a dentist coming from Chennai once a week, Dr. Freeman. And in 1950, a lecturer in dental surgery started the beginning of dental department. Now, the person who started the dental department is Dr. Modi, an Australian, with Brother John Lazarus in the year 1950. We started as a one-chair dental clinic in the directorate, which became a two-chair with a donation of a new chair and an X-ray. And in 1960, it became a three-chair dental clinic in the then new OPD in the first floor. And in 1972, we moved over to the present location with a six-chair dental clinic. Now, this is the council minute of 1950, which says that Dr. Modi is appointed, and 51, which says that equipment for anesthesia to do dentistry under GA can be started. Now, his name is Dr. John Eric Henry Modi. He brought the foldable dental chair in 1950, but got the new dental chair as a gift. And you see him working. This is the proposal when they started for a GA, ether anesthesia, with the theater here and the diagram. It started in 1950. Now, just to tell about some of the staff, is the picture of Brother John Lazarus, whose wife was a professor of OBG nursing in CMC. And most of you may know Joni. She's a 1975 batch of CMC, and with her sisters Betsy, Ruth, Shirley, and Elena. 1972, the 6-chair dental clinic was opened in the present location, and it had a air conditioned minor surgery theater where a dental chair was converted into a table, fully convertible, with a regular recovery room, X-ray, developing room, etc. And it also had a toilet and bath, because like any other theater, if there is need, you needed to have a bath. You will notice Dr. John K.G. Webb, the then director, inaugurating the dental clinic, Department of Dental and Oral Surgery. And you will also notice that Dr. A.S. Fenn, the then principal of CMC, Dr. G.T. Simon, the then head of Department of Dental and Oral Surgery, and Reverend A.S. Savary Ryan, who is the general superintendent in those days, and the board showing Department of Dental and Oral Surgery. Now, this is some of the staff who are there. Of course, later on, this picture was taken when Dr. K.G. Koshi was there later on. This is the picture taken in 1972 with all the people. I have kept this to show or tell about two things to you. Now, the first person whom I want to tell you is this man in the center. He's an attender by name, Mr. Natarajan. And this is the year 1964 when I joined the department. After about 3 months, one day, I always used to call him, wish him, good morning, sir. So one day when the then principal, Dr. Jacob Chandy, was there having treatment with Dr. Simon, this attender walked in. So I got up from my stool and wished him, good morning, sir. So he always says, no, sir, that's what he always says. But then immediately after that, Dr. Jacob Chandy called me to the dental office with the HOD and asked me, why did you address him as sir? He's an attender. So I told him, sir, I am from a government background, government dental college student. In government, we are told that if a person gets 1 rupee more than you, he is your senior and you have to address him respectfully as sir. My attender gets 70 rupees. I get 70 rupees as stipend. My attender gets 90 rupees. Now, should I call him sir or what should I do? Whether you believe it or not, it is a fact. The next month, the stipend was raised to 90 rupees for all the host surgeons of CMC. You can verify it in the council minute of 1964. The other person whom I want to talk to you about is this lady. Her name is John C. She was a very fantastic nurse. Again, if you notice, all the people in the picture, none of us belong to CMC. All of us worked in CMC. We come from different background, mainly government background. And believe me, we were a cohesive group. And I have seen this cohesiveness even in Madras Medical College. All the Christian students will join together. And this lady I want to tell, in those days, 1972, we never heard all this fancy sweeping machine, washing machine with all the dirty water being taken all around the wall. So they will pour the water in bucket and the water will be swept completely dry and sent. So she will stand there and pour buckets and buckets of water. And I found her as one of the most efficient nurse we had. Now, the progress of the department from 51, 54, we developed a head positioner. Or I will talk about all this later on. The one thing I wanted to tell you is the disposable needles and syringes, which happened between 72 and 84. In those days, disposable syringes and needles were used only in the operating room, blood bank and clinical pathology, ICU, and dialysis unit. Nowhere else they allowed disposable units, syringes, needles. Luckily for us, most of the senior staff of CMC used to come for treatment to dental department. So I showed them how we are using the same syringe and needle, which we are using it for a oral cancer patient. And in those days, the needle will be cleaned by a wire by the attender only. And I told them how much clean it will be. So it is safer for you. Even the syringe, you have to pull in, pull out. So you don't know what is coming in. And the sterilization at that point of time, you don't know. I'm not saying it was bad. So I explained to them. Then they said, why don't you ask the management? I said, I have asked. They are not giving. So they asked me for a suggestion. What should we do? I used to tell them, just walk out, buy the disposable syringe and needle for 3 rupees from the medical shop and come. Then later on, I motivated them to make the management start selling disposable needle and syringes for the first time in the first floor of the OPD, next to the pediatric office. And everybody used to go pay 3 rupees. Later on, they added on to the total expenditure. And that's all. That's one important thing. Step B2. The others I will tell you as we go. Now, this is that head positioner. The important thing about the head positioner is we can take serial pictures, whether it is a lateral X-ray of the skull or TM joint. We used to use it with the Siemens tomographic unit, and we can take right, left, closed mouth, open mouth, so that we can see the movement of the joints. And this was the first time we were able to do it in CMC. This is the ambidextrous type of electric dental chair, where the wash basin and the tray with the light moves along the buried rails around the thing. So if a left-handed person is there, they can work. The next is a perio test. The perio test is an equipment which uses sound to see the condition of the periodontium attachment to the tooth. So instead of taking an X-ray, a full mouth X-ray is a minimum of 10. And instead of doing that, a perio test is used. And where you find a need, then you go ahead and take an X-ray. This is the use of the equipment. This was the first time in India that CMC obtained this. So there are so many things which I have to be thankful to CMC management, because they allowed us to have the disposable needle syringe. They allowed us to buy the first perio test in India, surpassing all the dental colleges in India. No dental college had it. Then we also started a computer and photography section. You will see Dr. Topazian, Pauline, Mrs. Simon Ambujakshi, and their daughter Ruth. And he permitted Mrs. Ambujakshi Simon to inaugurate. Now, about the training programs, our department started training program for BDA students which was then not compulsory. And we started CDE program in 1969. All the other things I will keep telling you as we go through. Only thing which is there is dental assistant, which was started in 98 for qualified dental hygienists, qualified registered dental hygienists. Now, in the year 69, I told you we used to wash the department. It used to be every Friday in the afternoon. So at 2 o'clock, we used to go for MRD. As the number of cases for us were less, we had enough time. 3 o'clock, we used to have a departmental program, purely academic. And 4 o'clock, we used to have a clinical program where that week's cases were presented by our junior staff or by a private practitioner. CMC gave us special permission to permit the private practitioners of Vellore and nearby to attend this program, which was run regularly every week. Then, and there was no charge. Second thing is, for the first time, CMC permitted us to take dental x-rays for the private practitioners. The only thing is they have to give it in their own letter pad, advising x-ray of which tooth. These patients need not register in CMC as a patient. They walk straight to the dental department, have the x-rays taken, collect the film and go back. 2 minutes, we will give it to them. Now, this was done as a safety measure or a public health measure by the management to the patient, because in those days, there was no intraoral x-ray machine in Vellore Town. So if a patient goes anywhere else, they have to have an x-ray taken in the regular chest x-ray machine. And the chest x-rays were cut into that, 2 centimeter sizes, and the edges will be covered by plaster. So there will be leakage of light, and the pictures were not good because they are not meant for teeth. And they will have to have a full mouth x-ray of 10. So the CMC was very conscious of that. So they permitted it as a special case. So many things CMC did for the public of Vellore. And then from 70 to 90, we conducted 52 dental camps, benefiting about 39,000 people at an average of 750 people per camp. Now, this was started in 1990 because the Tamil Nadu government passed an order that it should not do extractions in the private clinic. This is Professor McIntosh, Professor of Oral Surgery from Detroit, who came as a volunteer in Health Volunteers Overseas by the American Dental Association at our request. They visited CMC as well as other institutions, but chose CMC for the program. So they used to teach maxillofacial surgery. The program was permitted for 2 years, extended for 2 years, and a special permission to have 1 more year. Some of the past trainees, Dr. Rajendra Prasad, who became the first PG teacher in orthodontics in Bangalore GDC, where I graduated on the first batch. Dr. Rajagopal became the first vice chancellor of Sabita University, and Dr. Paul Sanin. This is Dr. Rajendra Prasad, and the other 3 of us were the first batch student. And this is Dr. Rajagopal. And this is Dr. Paul Sanin. After his dental degree, he did his medicine and became the managing director of Narayana Hridalaya and Mazumdar Shah Cancer Hospital in Bangalore. This is some of the past trainees. Heads of department, Dr. Moody was there for the full service of 5 years. Dr. Topassian was there for the full period of 4 years. And Dr. Simon was there for 16 years. Out of 20 years he served. And I was there for 25 years out of 37.5 years. It's interesting for you to know, when our department is celebrating our 75th year, our Diamond Jubilee, I had worked 50% of the time in CMC. There is one more thing which I want to mention at this time. I had shown in the slide 2 Diamond Jubilees. you'll be wondering how two diamond jubilees. In the earlier years till 1897, 75th year was considered as a diamond jubilee. In 1897, the then British monarch Queen Victoria was going to become 60. So she felt 75 years is too long a time for a person to wait to celebrate a diamond jubilee, and she wanted a diamond celebration. So she made a rule that from now onwards, 60 years will be the diamond jubilee. 75 years is all right for an institution which has a longer time period. That's how the diamond jubilee came. Here are the pictures of Dr. Modi, Dr. Topazian, Dr. Simon, and Dr. LBM Joseph, who was the director at that point. Now, the staff in the 50 years, Dr. Modi was appointed a general surgeon because at that point of time, CMC wanted to change from LMP to MBBS, and we needed a lecturer in dentistry as per the university and MCA regulation. So Dr. Modi was appointed. But in the same year, he also took the responsibility of being the warden of the men's hostel. And 51, he is the one who started the Evangelical Union in CMC. Brother John Lazarus was a chapel secretary till 1980, till he left. And I happened to be the deputy director for 8 years and associate director for another 8 years. Again, these things I will show you. So I will not discuss it at this point. The first one, the cephalostat has already been told in India. The second is the flannel graph. I'm sure that most of you have seen and used a flannel graph, which was on various fields of medicine, but not on dentistry. The first one on dentistry was made in the year 1979 with the help of our audiovisual department. And you can see the pictures. The next is in 1997, when there were a lot of infectious diseases. I was able to get all the medical staff of CMC to help in getting a book as Emerging Infectious Diseases, a handbook for dental surgeons. And I have to specially mention my special thanks to all the medical staff who helped. Then we did a puppet show, which could be either with the strings or with the hand. I will show it last. Then we started a free dental service with the clinic in the help of the town. This is the clinic, and the first 3 years, one of the dental societies supported it. 1 year, the trust which was running it, Vellore Medical Trust, and 16 years, CMC supported it financially. We managed it. We were forced to close it in 20 because the treatment was there free. No registration, no consultation, no fees for extraction, no charges for medicine. And we were using everything. Disposable gloves, syringes, syringe cutter, needle destroyer, everything was there. So we couldn't afford the dresses which you have to put post-COVID. So we were forced to close it. And over the 20 years, we have covered about 1.6 lakhs of patients with about 60,000 extraction. And in the year 2020, we saw 10,000 patients and 5,000 extraction, or an average of 36 patients every day, and 19 patients having extractions, all free. Then we celebrated our Golden Jubilee with the then President of the Dental Council of India, Dr. R.K. Bali, who also released the Golden Jubilee souvenir. This is the participants of the Golden Jubilee, and then it was time for me to leave. So they gave me a farewell with all the then trainees and the staff, past staff. Now I want to share some photographs of the patients and work done by the department over the years, all mainly old. This is in the year 1962. They did a bilateral cleft lip and a single stage lip palate repair. For all this, Dr. Lucas I don't know whether anybody knew. Dr. Banerjee will know. He is a MS from outside, CMC student who was assisting with Dr. Topazian. For those who are doubtful, this is the operation notes of 1962, which shows Dr. Lucas as the assistant, Topazian as the surgeon. Now, this is another patient with TMJ ankylosis treated with iliac crest bone graft, with Dr. Topazian operating along with Dr. Maniam Mani, who was a MS registrar, who also became a plastic surgeon and the head of department. This is the operation notes of 1962. Now, in 69, we started a cosmetic or surgical orthodontics. And this is the first patient we did who had a maxillary prognathism. After surgery, you can see the profile. Now, we had to remove one tooth here, and move the anterior maxilla back. This is the model which shows that. Then we also took composite X-ray photograph for the first time in India with our photography department. Some of you may or may not know, but we took the negative of the picture, put it in a sleeve. The sleeve is put here and it is projected over the lateral X-ray. And the lateral X-ray had a line, lead line. We used to put a lead line and focus it so that the soft tissue superimposes over the bony tissue. Some of you will wonder that fashion started in 20th century. No, this is a patient who came in 1970. And I think she had better earrings and gold. And this is the bimaxillary protrusion, which was operated. Then we had all types of mandibular prognathism, vertical face elongation, mandibular retrognathism, treated surgically with the pre and post-op pictures. And a cleft palate patient, whom we did it with the alveolar segmental osteotomy, where each tooth can be sectioned. And as they have to be kept post-op together, we made an acrylic splint for post-op. And we were the first in India to use acrylic for implant in mandible. And this is the picture of a person, CA of the left buccal mucosa post-op. You will notice that there is good profile, except that at this point, there is a slight depression because the implant did not have a coronoid. Again, we were the first to use acrylic as an implant for craniotomy. We had very good cooperation with all the departments in CMC, in addition to the management. This is for a tumor excision, and this is for a defect. We used to make the acrylic implant earlier and fix it in the theater. And maxillary, partial maxillectomy, total maxillectomy with the prosthesis. And you will notice that this patient had a total maxillectomy. This is with the standard Weber-Ferguson approach. And this is the result. Nobody will believe that she does not have a maxilla, including the floor of the arm. This is if a person does not have a prosthesis, how they look. We also used to have appliances for speech bulb, and we had a lot of skin grafts as an adjunct. So the skin graft is wrapped around the acrylic and placed in the nostril. This is for a nasal prosthesis. They all had holes for breathing and for vaginal atresia, vaginal prosthesis, which was hollow. Because it is hollow and they were wearing it around the head. The pack change is very easy. There is no problem. Graft doesn't get disturbed. All the drainage comes out. Then we also had a lot of substitutes. One for trismus. Second is for surgical patients for dilator. Ear mold for close adaptation for ENT, and for ICU patients, acrylic tubes for tracheostomy tube because they will cut through. You can see. Then we also had one patient, quadriplegic patient, who had a acrylic prosthesis. Since he had only movement of head, you can see him taking the water, touching the water, the paint box, and the paintings. These are some of the paintings done in the year 1980. So we had to work with occupational therapy, all the departments we have worked. Now, personal accomplishments, I want to tell only two things. Because of CMC, I became a Senate member of the Tamil Nadu Dr. MGR Medical University when it started. The university has one person automatic, which is the principal, and one professor from the complete faculty of CMC. I was fortunate that all the medical staff supported me and made me as a Senate member, which is permitted only for 2 years, which also helped me to become a member of the Dental Council of India, representing the university. The second thing is, I was the first dental specialty person in a medical college who is appointed as a specialist in their specialty. I was appointed as a professor of orthodontics. I don't know about what is the present position now, but mine was cleared by the university. I thank all the people, particularly Brother John Lazarus and Dr. J.T. Simon. Of course, none of this would have been possible without the active support of my family. And it's my wife, Christabel, who worked as a teacher, my elder daughter, who belongs to the 90 batch of MBBS and 97 batch of MS General Surgery. My younger daughter, Raji, 95 batch of Rajas and 2001 batch of Ragas. Of course, with the center of Jesus Christ. Thank you very much. I'll just take 2 minutes to show you. This is the puppet show with the fingers, which they have done. The community health nursing students have done it now after 2001.
Good morning, sir.
Good morning, dear students. I have a happy news to tell you all. An important announcement to make regarding the elocution competition which is to be held at the district level. The winners of the competition will receive prizes from the President of India on 26 January, the Republic Day. So those who want to participate in the...
Get up. I have made coffee for you.
Don't give her bed coffee and spoil her, Lakshmi. Ask her to first brush her teeth.
Vidya was preparing for a competition last night and she only told me to wake her up by 4 o'clock.
Vidya, get up.
Mommy, is coffee ready?
Vidya, your mother said that you were preparing for something. What was that?
Yes, Dad. Our sir said there's going to be an elocution competition at the district level and the winners will be getting prizes from the President on the Republic Day. And I'm going to participate.
Vidya, get up. It's time. Get up fast.
My tooth. It's aching. Mommy, my tooth is aching.
All that will become all right. First go and brush your teeth.
No, Mommy. I really have pain. See, there's a swelling also.
Yes, Vidya, it looks bad. Is it paining?
Yes, Mommy. It's paining. Toothache since morning. See, there's a swelling too.
Toothache. Did you eat your lunch or not?
My tooth is paining severely. It's swollen big. Mommy, I'm finding it difficult even to talk.
That is why I have been telling you not to eat anything before brushing your teeth. And rinse your mouth after eating food, especially after eating chocolates. See now what happened.
Mommy, will I be able to participate in this competition? This was my dream.
Don't worry, Vidya. Let your daddy come. We will go to a dentist and you'll be all...
Excuse me, doctor. May I come in?
Yes, come in.
My daughter is having severe toothache, sir.
Since how many days?
She's complaining since morning.
What is your name, my child?
Vidya, doctor.
Vidya, open your mouth. Yes, she's got dental caries. It is in a very bad condition. It has to be removed.
Okay, doctor.
But I can't remove it now. For the time being, I'll give you some medicines. Bring with you tomorrow, then I'll remove it.
Doctor, what will happen if you remove my tooth?
After it is being removed, you'll have pain, swelling, and difficulty in talking.
Doctor, then I won't be able to participate in tomorrow's competition?
Yes, Vidya, you won't be. Why are you crying, Vidya?
Doctor, I have been preparing hard for this many days.
Don't worry, Vidya. You can participate in the next competition.
How did I get this dental caries, doctor?
Before knowing about dental caries, we should know about the structure of a tooth. Each tooth is fixed inside a cavity. There are nerves and blood vessels inside this cavity. This is called pulp, which helps to grind the food. This pulp is surrounded by a thick sheet called enamel. When this enamel gets affected, we call it as decayed tooth. Decay of the tooth is because of sticky substances and acids from the sweets and foods which get settled on the enamel of the tooth. These substances attracts bacteria which grows on the teeth and causes tooth decay. This causes pain and swelling. Because of this, we are not able to use this tooth.
Is there any way to prevent this, doctor?
We can easily prevent this dental caries by simple ways. We should not eat sticky foods in between our meals. We should eat vegetables, fruits and greens and milk, which gives strength to our teeth. We should brush our teeth properly both in the night and in the morning. We should rinse our mouth after eating, and then particularly we should not eat sweets at night.
Who was supposed to conduct this competition has gone off.
Is it true that you have won the competition? Congrats! You will be receiving the prize from the president.
And this was done after 2001. So I don't take any credit for this. But the previous one, we did it, and I had very good cooperation. And the nursing students in community health did an excellent job. It's not that puppet show was not being used. They were used for a road or common area, but not no video was taken. It's the first video in the world on oral health. Only one interesting thing I want to share with you. In the earlier years, that is around 80s, the total OPD had a posting of nurses. Because it is a 9 to 5, they always used to post people who are in their second or third trimesters of pregnancy, both in our department as well as in other area. So I wanted to stop this. So when I was taking a lecture for the nurses in the nursing service as well as in College of Nursing, I explained to them about stray radiation, because in those days, all the x-rays were taken in dental department. So I said, and we had, fortunately, they had left about 2 feet short wall. So I talked about stray radiation and how it is more harmful to the baby than any other thing in, even in theater. So it was taken up by the nursing staff very firmly, the nursing service. And then they stopped posting pregnant women in dental department. I don't know about others. So we had a lot of pleasant things I have in the CMC, and I thank the management and all the department. I have worked with all the department. That is a privilege I had. So I'm very grateful to God for all this. Thank you once again.
Thank you, sir, for a very lucid presentation, taking us back more than 50 years of the time when he was also aware of what was happening in CMC as he came in as a youngster, as a PG. He went back and did PG in orthodontics, came back and built up the department. So it was my privilege to be called to work in CMC. He was Dr. Samraj was the one who invited me back also the second time I came back in 1990. And it's a joy to be part of this department and of this institution. And I had to have good mentors. So this morning, I would like to talk about the second part of what we are looking at as our heritage, as we are saying, what we have received and what we pass on to the next generations. As we said about the early years of CMC and of our dental department, it's the pioneering, the foundational work, the nourishing of the department as we looked at the work of Dr. Moody, Topazian, Dr. Simon, Dr. Samraj, Dr. Umar Raman, and Dr. George Ipe, and others who have been part of this wonderful department. And also those who have been assistants, as Dr. Samraj referred to, Dr. Brother John Lazarus, the wonderful tradition that followed, because he was such a versatile person. He came in as a nurse, but he learned, he did hygiene work, and he did technical, mechanical work, and he did just about everything. He was a jack of all trades and a great help to the department, a great inspiration to many. And so many others like Mr. Manohar was like my backbone in the department here when he assisted me, and all the others, as we see, were really a blessing, the roots actually of our department. And as we look at the next phase, as you've seen at the roots, we also look at a tree. We can imagine a tree and imagine that it's also the stem of the tree is actually the indicator of the maturity and the middle years of the department, the supporting, building up, enduring, encouraging aspects of a tree which grows, and of an institution or a department or any place. It's so important for the dimensions of quality, productivity, stability, and outreach to be part of any growth. Without all of this, we can't grow, we'll only regress. And so we are looking at some of those aspects about what does quality mean, and safety, clinical excellence, and patient satisfaction is what we identified. And as Dr. Samraj is talking about safety, the whole issue about even needles, it was important to make initiatives to pioneer in certain areas where we would have to actually take the risk and do things differently for the sake of the patients. When I started dental practice, it was, as you can see, with bare hands. I don't think the present generation can even imagine touching a patient or working on dentistry with bare hands. And that's how we all started, because that was a period where it was just understood you do your work and there's no risk, no problems, because we didn't even understand that there was a risk to the dentist or the doctor. In fact, it was only around the late 80s and early 90s that research and study and reports started coming back that dentists, oral surgeons, and cardiothoracic surgeons were the most at risk to develop hepatitis B, and that it became even HIV. So that's when the whole understanding that something drastic has to happen in terms of infection control. And so we had to actually develop the whole concepts of universal precautions and the care of the high-risk patient evolved in that period of the early 90s. And as Dr. Samraj was very instrumental in getting this book done on infectious diseases, and this was printed by the Indian Dental Association and distributed to every dentists around the country, and it was really a great teamwork effort because various departments are involved. There's the microbiology, virology, the infectious diseases departments, the pediatrics, the infectious diseases, and all working together to develop something, the guidelines on how to prevent dangerous infectious diseases affecting both the doctors as well as the patients, and the staff. So it was very important that we made these initiatives, and it was something which was also a standard for the rest of the country. And then we moved on. It's also a period of developing clinical excellence, evidence-based guidelines and protocols, documentation. When we have such fantastic facilities, whether it's investigations, whether it's radiology, or whether it's lab investigations, or it's reporting and even records, medical records, and the CHIPS department, such fantastic support systems we have no excuse for not developing systems and going on to clinical excellence. And so we had the opportunities to review our data and to audit and to develop manuals and to build up our consultation systems and comprehensive care were all areas that was to just improve our clinical excellence. And that guidelines, whether it was guidelines for evidence-based dentistry and high caries index to TM joint ankylosis, as Dr. Samraj was saying, each area we need to actually understand what's best, what's most appropriate, not of reinventing the wheel, but of doing what's just right and doing it right the first time. So all these concepts had to be developed and evolved as part of the growing period of our department. And also to be able to make initiatives that ultimately quality is about patient satisfaction, and being able to provide them the best so that they know that they are being cared for and that it is for their benefit. The system is patient-centered. It's not about us. It's about the patient, and the patient is the one around which healthcare works. And so we had patient education, preventive care in terms of tobacco cessation, well-mouth clinics, doctor-patient relationship, which we learned from other areas, whether it was family medicine or it's just initiatives about patient-centered care. And the whole concepts of productivity, from quality, it was important not only to provide high quality, but to be highly efficient and to be a productive department. And the concepts of four-handed dentistry and clinical training, as I was saying, in 1988, we started the first chairside assistant training programs, and in the importance of recognizing how manpower can actually help us improve our efficiency, because the needs were so many patients coming in here. And as Dr. Iraska herself realized that she as one person couldn't handle it all. And she recognized the need that she had to first develop training for pharmacists, then training for nurses, and then of course to meet the needs of the country, it was training of doctors. And as we see, the first dentist, Dr. Moody, working on a patient with standing dentistry. Many years it was standing dentistry until we, in the late 90s, developed the whole concept of four-handed dentistry, where you could actually sit. It was efficient for the dentist and the assistant to be able to work together and to be able to provide safe care to the patients, and also very efficient care, because it was actually multiplying your turnover by dividing the time that you actually worked per patient. And we had great supporting staff. A great team has been developed, and we are very proud of you all. Many of whom are here, whether it was the hygienist team or the dental technicians team or our attenders, and definitely our nurses, who were really the backbone of our department, and of course our secretaries. Thank you, Mr. Prakash, for helping us. Of course, the next dimension is, we have quality, we have productivity, we need to have stability. We need the department to be built up and to grow on the basis of a strong foundation. And so it was about about consistency, the importance of having people stay back, stay on rather than just keep moving on. And it's like a rolling stone which gathers no moss. We are not going to really build up, and nor do those individuals build up. So I'm grateful for people like Dr. Santosh and Dr. Jagdish and all who made the choice to stay on, and then so many others like them. And then importance of working together as teams and building up of education. That was the time in the 2000s that we started actually our first training programs, initiatives, pioneering initiatives in the country, actually general dentistry training and postdoc training in maxillofacial surgery. But these are basically not just on academic training, but on competence development, because we felt that's the need. We want people with skills and not just head knowledge. And so the importance of building up of teams which are able and capable of providing and delivering the goods. The importance of having good systems in place so that what you actually make as development, as initiatives, in quality development, they have to be converted and put into practice through systems. And of course, the best system is people. It's human resources. And we've had a strong foundation, a strong building built up on the bricks of people who actually provide. And so these are the people who are very much here. And we're grateful to all of these who have actually contributed to making this building up this institution, building up this department. I'll be spending a lot of time, but each of them is so very special. You can identify them in the pictures. And of course, the initiative of outreach began earlier, but not only to the local area, but to actually start clinics, whether it is in Rusa or whether it is in LCC or in Shalom. We had the initiative to get out of our comfort zone of the main hospital, start working there, providing healthcare, providing opportunities for the local population to get good care. And whether it was in school camps, village camps, and providing actual services, providing the same quality of service that we have in the main hospital at a much more subsidized rate to the patients. And also providing them patient education. And of course, also supporting the larger mission network, which was part of our desire and our dream to be able to reach out to the local SMH or to Bangalore Baptist Hospital or to Duncan Hospital in Bihar or to Odanchetram Hospital, and try to actually integrate into a common educational program too. So as we realize, it's a branch, it's a tree, it's a stem, and there are branches. And Jesus is the one who said, I am the vine, you are the branches. If you remain in me and I in you, you will bear much fruit. Apart from me, you can do nothing. When we recognize that Jesus is the branch, Jesus is the real stem, we as branches will just bear nothing. We can do nothing apart from Christ. And to know that it is Christ who is actually evolving our department to grow. And so if we have roots, we have stem, we have also branches. And that's the period of multiplication, diversification, and specialization. We realized that the department was actually growing, and in 2010 we had 2 units forming, and it looked like a division, but actually it was the first stage of multiplication. Very grateful to God for that opportunity. And thereafter, recently, last year, we have now had 6 units, discipline-based, and that's a big jump indeed. Very grateful to the administration for all that has transpired. And of course, we have now each of these units growing and developing branches of the main department, Dr. Saumya and Dr. Lily and their team. And there's a long history for each of these areas, and we will not be able to cover it in this presentation, but hopefully in later opportunity, we'll have opportunity for it. The oral maxillofacial surgery team, the present team led by Dr. Santosh, Dr. Arun, and Dr. Saurabh, and all the assistants and the trainees. We are so grateful for a bigger team growing. And Dr. Saurabh over there. And of course, we also have a section there in Chittoor, the dental department there, led by Dr. Anu, and Dr. Ajish is also there, and Dr. Deepthi there, and prosthodontics led by Dr. Sibu Simon, and it's a large prosthetic team, and Dr. Rebecca there. And of course, periodontics and endodontics led by Dr. Shiny, and endodontics, Dr. Moses is there, and we have Dr. Tulika also joining recently. And oral medicine, Dr. Jagdish heading the unit, and helped by Dr. Jessie and her team over there. And of course, also the general dentistry team, which is still much of the stem of the department, as led by Dr. Christina, helped out by Dr. Gladwin and Dr. Shiny, and you can see it's a growing team with many trainees, various levels of training, because we have the certificate in general dentistry and also the advanced general dentistry programs. And as we recall, we realize that we are all called persons. We are chosen by God. And that's what Jesus says. You did not choose me. In a sense, we may think we have chosen to come to CMC, but actually, it's God who has chosen us, called us, and placed us here. It's an opportunity that God has gifted us. You did not choose me, Jesus says, but I chose you and appointed you so that you might go and bear fruit that will last. So we are called here not for our sakes, but for a purpose and a plan, which the Lord knows. And we are called here to bear fruit. So if we have branches here, we are called to bear fruit. Ultimately, that's the purpose for what every one of us is here. And fruit bearing. So as we're looking forward to the years to come, we can even it's good that we are at a time when we are also at a consultation looking at the next 10 years, maybe the next 20 years or whatever, and looking ahead to a time when we can become a center of excellence, a center of postgraduate education, a dental college, outreach at the local level, at the national level, can have educational outreach and perhaps in global collaborations. These are all dreams that can become a reality, because we know that we are working not by ourselves, but in partnership with God himself. And that's the vision. Education, research, service. These are the primary areas for which CMC stands for. And these are the areas we hope will develop as we grow as a department. And of course, the CMC vision is not just about education, research, and service, but that it all leads to one thing: to witness to Christ. And that's the vision statement of CMC. We are a witness to Christ through education, research, and service. And so we are called to not just bear any type of fruit, but good fruit. And what is this good fruit? It is to manifest that we have actually the love of God in us. We recognize and realize that this love is what keeps us together, what enables us to work together in unity and not in cooperation, a spirit of cooperation and working together rather than of competitiveness. To recognize that we are here for showing compassion to those who are needy and those who need our services, those who are neglected, and to be able to look beyond ourselves and recognize the role of justice in our work, of reaching out to people who have no other opportunity, to reaching out to the poor, the underprivileged, those who cannot access our services. So we have this privilege here in this institution to also do work which is appropriate, what is right, and not to do anything that is unnecessary. That is yet another privilege that we have, and to manifest the righteousness of God. And to be people who can work in a spirit of servanthood. That service which Dr. John Scudder and Dr. Generations thereafter and Dr. Ida Scudder put it as the motto of this institution: to serve rather than being served. To know that it's not about seeking position, but of seeking to give off our best to the people who come to us, whether it's our colleagues, whether it's our students, or whether it's our patients. to realize that we are here and it is God who gives us patience and resilience as we experience even through the crisis of the COVID and various other situations where we know that we are able to do this all because of the grace and the presence of God with us. And these are the good fruit, which is also the good news that we carry to the world. The message that we carry to the world of all of these things, which is manifestation of the character of Christ. And this is what we are actually having to pass on to the next generation. This baton of service to be able to convey this message, this good news to those who are here and those who are to come. That we are here with a purpose and a plan, and that we are here because we've been blessed to be here. It's looking back, it's a joy to recognize that we have been blessed in many ways, and as we have shared this morning. But this blessing is with a purpose that we may be a blessing to those generations to come, to blessing to others in this world that God has placed us in. And we are very grateful to God for this opportunity to share, to look back and recall. Dr. Samraj, myself, and our colleagues want to thank God for this wonderful opportunity to reflect and to be able to share of God's goodness and grace. I want to thank the institution and the administration especially for taking this initiative of reaching out and enabling the departments to be able to talk of how we have all received a heritage, and a heritage we want to pass on to generations to come. So we are very grateful for this opportunity, and I want to thank everyone who's come here this morning, and pray that we will all continue to work together in that same spirit of unity to be able to manifest the life of Christ in us. Thank you. Thank you very much.
Thank you, Dr. Samraj and Dr. Rabin, for the reflection on the journey of our department and the values, the vision, and the commitment that have brought us to where we are. Our department is grateful for all the support we have received over the years from the institution and for the dedication of every member of our staff, current and former, who have contributed to our growth, and as we continue to work towards providing the best care to our patients. Thank you.